One of the things that we've learned over time is that headaches are best treated in the context of a headache clinic or a headache program. This brings together multiple disciplines, including radiology, physical therapy, and other areas of expertise that can be brought to bear to treat whatever kind of headache someone has. The first thing to do, if you've got a headache and simple measures, over-the-counter medicines aren't really working, chiropractic intervention really hasn't helped you, the first thing to do is get into a headache center and get the type of headache properly diagnosed. Certainly it's true that brain tumors and aneurysms and various other scary things can cause headaches, but typically that's not what's going on. It's important to investigate, to rule these things out with appropriate types of MRI, appropriate studies otherwise, and not just any MRI or any blood work, but blood work and MRI specific to the diagnosis of headache type. Once the headache type is pinned down, and sometimes an individual may have more than one kind of headache, then we know about a number of interventions which may help that individual. It may be physical therapy that they need, or perhaps they have headaches induced by sleep apnea or some sleep-related disorder that simply needs a CPAP mask or something simple. There are certainly a lot of medications that can be given on a daily basis or an intermittent basis to help with headaches. And depending on the headache type, the treatment would be very, very different for individuals. If you go into a headache center, the expectation should be that there's a 70% chance you will get rid of your headaches or get them under your control. There's a 30% chance that you may not get complete control of your headaches, but you can certainly get some control and improve your lifestyle. And it's only the rare patient that can't gain control of their headaches through the simple startup measures that would be applied when they first come to a headache center. And those individuals, we have to go deeper and look at more options. But I'll tell you, a lot of patients come in and they tell me, Doc, I had an MRI done 10 years ago and they didn't see anything. I've had all this blood work done and I've been on every medicine there is. But when we start interviewing them, we find out that in fact, the MRI they had was a more or less generic MRI. Sometimes if we repeat the MRI and do it a slightly different way, we find something that was missed on the previous MRI. Nobody asked them about their sleep, and sometimes that's critical. Perhaps certain blood work was not checked for, certain inherited disorders that cause headaches, and we can rule those out. When patients are given a list of all the available treatments for headache, even the individual who said, I've been tried on everything, there's nothing left, is usually amazed. They've usually been tried on less than 1/10 of what is available. And that's why in a headache center such as ours, we have such a high success rate. Because we know of treatments that have not been applied. And the average physician, the family practitioner, has one or two really good treatments for headache up their sleeve. They'll try these. If they're successful, that's great. If that doesn't work, then the primary care physician has a lot more to worry about than headaches. At our center, on the other hand, we make it our business to worry about headaches. And since I'm a headache sufferer, I take it very personal. We try to keep up with all of the literature. We investigate new therapeutic approaches for headache, and we involve ourselves in research in the headache arena, which is not something you can get from just any neurology office or your primary care doctor. And if that's the type of headache treatment and the depth of headache treatment you need, we do provide that.